All across the country, people are struggling with obstructive sleep apnea. And the kicker, a lot of folks don't even realize what's going on. So Dr. Duplan is here for this week's Check Me Out to tell us everything we need to know about the disorder. How you doing?
Doing great.
All right, first things first, for people who haven't heard of this particular term when it comes to sleep apnea, can you give us an overview of what we're talking about?
Sleep apnea is when you try to sleep and you get to a deep layer of sleep where you obstruct and just can't breathe. A lot of people just have a lot of loud snoring, and they don't get a good night's sleep. They wake up in the morning almost more tired than when they went to sleep.
Wow. Now, we know everyone who snores doesn't have sleep apnea, but are there any symptoms or triggers you should look for to make you say, I probably should get this checked out?
Well, the main thing is if you notice a spouse or a sleeping partner will notice that there'll be interruptions in the breathing, where the snoring may be regular for a little bit, and then all of a sudden it's like there's a pause. Yeah. And you feel like you need to push them and wake them up to start breathing again.
Okay.
And sometimes it's not as easy to tell. Sometimes some people don't snore that much and still have sleep apnea.
All right, so let's talk about some treatment options for folks who are diagnosed.
Okay. Of course, there's you do a sleep study to determine that that's what's going on. And once you're diagnosed with obstructive sleep apnea, the main therapy that's been used for years now is the CPAP, which is a mask you wear at little positive pressure.
I've seen that at the dentist. They have the signs in different literature about things like that. Yeah.
So it works great. The only problem is some people just can't tolerate it.
Yeah. Because
you have to sleep with the mask on, and sometimes it takes a pretty good amount of pressure to work for them.
Got it. So if you are someone, you've realized you have sleep apnea, you tried this device and it's just too tough for you, is there any relief out there?
Yeah, there's been several different surgeries that have been done in the past, but the success rates have been kind of not as good as what we'd like. There is a new procedure out that seems to work really well, is the Inspire procedure, which is an outpatient surgery that basically is like a little pacemaker device. That the little device is implanted in the chest, and it sends a signal to the tongue whenever you go. It senses when you go to take a breath, and it'll send a message to the tongue to move forward out of the way.
Amazing. So there is some relief for folks to get information about something that could help them out, right?
That's right. It's something that when it's off, it's like everything's normal. And then when they go to bed at night, they have a remote control that they can turn it on, and it automatically brings their tongue forward, and they don't complain about this as being an uncomfortable sensation at all. In fact, it gives them a little time to go to sleep first before it starts.
Good stuff.
But it eliminates the snoring and helps them to sleep without any external device.
Good stuff. Thank you so much for coming and sharing all of that information with us.
Oh, okay.